Platelet disorders. Introduction. Which of the following blood components helps stop bleeding? Choose one of the following options. 1. Red blood cells. 2. White blood cells. 3. Platelets. Correct. Platelets form blood clots. Sarah has noticed that she has been bruising easily. She has also had a fast heartbeat and a fever. Should Sarah contact her healthcare provider? Select yes or no. Correct. Bruising, a fast heartbeat, and a fever may be signs of a problem. Sarah should contact her healthcare provider. Having a low platelet count can lead to mild to serious bleeding. Select true or false. Correct. Low platelet count disorders are sometimes referred to as bleeding disorders. Having too many platelets can increase the risk of blood clots. Select true or false. Correct. Blood clots may lead to complications such as the loss of a limb, strokes, and death. People with hemophilia have blood that does not clot properly. Select true or false. Correct. People born with hemophilia have little or no clotting factor. Thank you for using Explain.